Let's bring in a member tonight of that very committee to dig a little deeper and what solutions might exist. Congressman Raja Krishnamoorthi, thank you for joining me. I know you're a Democrat of Illinois. You're on this committee that is looking heavily into this issue that Americans really care about. You know, in previous years, drug prices, they're going up much faster than inflation. It's not as simple as that. Bread isn't going up that much. Milk wasn't going up that much. Why prescriptions?
You're right. Basically, it appears that just over the last 4 years, drug prices have gone up 36%, 4 times inflation, and 1 in 4 Americans are struggling to pay for their medications. And I think the main reason why is that, essentially pharmaceutical companies, those who produce these pharmaceuticals, are able to basically exact or establish monopoly pricing for their products in ways that we don't see in other industries.
Let me just take out one kind of extreme example, but it illustrates the point. Trikafta. It's made by a company called Vertex. It's for cystic fibrosis. Apparently there's no viable competitor. $311,000 per year. And I put myself in the position of, you're a parent or you're a person with cystic fibrosis. You already are doing everything you can to keep that person healthy, and this on top of it. How is that possible, the price is so high?
Well, certainly part of it is, companies invest a lot in developing these drugs, but for that amount of money, you have to wonder, could it be lower? Especially for certain drugs that have been on the market for decades. Just take insulin, for instance, something that millions of Americans take on a regular basis. Insulin prices have gone up and up and up to the point where, some people have to ration their insulin. And, that's just wrong, given that the formulation, the scientific formulation of insulin has not changed. And yet prices keep going up. And that's the surest sign that something is wrong in the marketplace.
I have these conversations with my family right now. I'm sure you probably had the same with your family, and so many millions of Americans have, of them saying, I need this medicine. I can't afford this medicine. Can you give us any hope that by the end of, let's say, December 2023, because we don't know if Democrats are still going to be in charge after that. Right now we know the makeup of Congress, that this will be passed in a meaningful way?
I certainly hope so. We are very close on certain of these essential components of the BBB bill. I'm hoping that we can get past the finish line in the coming weeks and months. But it would sure be helpful to have your viewers and others advocate for these particular provisions. As you said, everybody at some point requires medications. And the question is, should people be forced to choose between paying for their medications, their life-saving medications oftentimes, and other essential items such as food and rent and their car payment and so forth? Mm-hmm. It doesn't make any sense that in this country we would force people to make that type of a sacrifice. Finally, I would just say, in other countries they don't necessarily engage in these types of conversations because their medications are much more affordable. And so if these companies are able to profit just fine in other countries at the prices that they charge those customers, it's only fair that we get charged the same.
Honestly, sir, right now it does not look like BBB is going to pass. If they do want this to come up as a standalone, that you said people should speak out, who would they call? The chairman of your committee, Nancy Pelosi's office, Chuck Schumer, who should they call?
They should call their member of Congress and their senator, regardless of which party. It's that important that those people hear from their constituents about the importance of this issue, and I can't overstate the importance of this issue either.
Congressman Raja Krishnamoorthi, thank you for taking the time. Thank you for explaining a lot of this stuff that is so convoluted, but so real life and meaningful to so many millions of people.
Absolutely. Thank you so much for covering this very important topic.